Hello, folks. Thank you for listening to Mountain Mule Media, Connecting Montana. I'm your host, Tim Baldwin. This podcast is a production of Mountain Mule Transportation. It was created to help locals and travelers connect more deeply with the businesses and people who make Montana such an incredible place to live and visit. In each episode, I sit down with Montana business owners and community leaders to hear the story behind their work, how they got started, what they've built, and how they help create a better experience for both residents and visitors. If you enjoy this podcast, please subscribe on your favorite platform. And if you use any of the services or businesses you hear about here, let them know you heard about them from Mountain Mule. And when you need private transportation with Montana's hospitality, please think of Mountain Mule Transportation. Thank you for your support, and I hope you enjoy the show as we keep connecting Montana. Jereld Rice, Gallatin Veterinary Hospital. What can you tell me about the business? Thanks for being here.
Yeah, you're welcome, Tim. So Gallatin Veterinary Hospital is an old hospital in the Valley. I am not that long with the hospital, but I'm happy to be there. I believe it's about 20 years old. So it's been here in the Valley serving people and pets for a long time. We have 6 veterinarians there, and we provide general care for pets, dogs and cats, as well as urgent care. And so it's a real privilege to serve people and their pets and get to know people and help people's pets stay healthy.
Okay.
Yeah.
And what's the emergency side look like?
Yeah, the emergency side. So we don't necessarily market. I shouldn't say market. We don't necessarily put out there that we see emergencies because we're not an emergency facility. That said, our clients, many times non-clients, will call us and say, "Hey, my pet was injured while I was out bird hunting or whatever. Do you have time to see him?" And, we're going to do our best to get you in. Certain emergencies, we may say, and maybe even certain times of the day, we may say, you know what, we feel like you would be better served going straight to the emergency facility. But we do our best.
So you guys aren't there 24 hours?
Correct. We're there from 7:30 in the morning till 5:30 in the evening. And seeing scheduled appointments, as well as, like we talked about just a minute ago, the urgent care side. We see, people call us up and say, "My dog's vomiting, my dog got hurt, whatever. Do you have time to get him in today?" And most of the time we can accommodate those pets that are needing some urgent care. Maybe not on the, the emergent side, but the urgent side. Yep.
Is there anything specific you guys specialize in?
Yeah. So what I'd say is we specialize in being generalists.
Okay.
Yeah. Yep. We do a lot of preventative care. We do a lot of dental care for small animals, dogs and cats. We do, of course, the maintenance, the vaccinations, the deworming. We do surgical procedures, spays and neuters. We do mass removals, those sorts of things. All that said, we do have a board certified specialist in our practice, even though we're a generalist practice. Yep. He's a theriogenologist, which means he specializes in veterinary reproduction.
Okay.
So reproduction of animals. Yep. And so that's pretty fun. That's really cool. And so he actually did an additional residency after vet school. He has that board certification, and he provides those reproductive services for dog breeders primarily. Yeah.
And is it any other small animals or just dogs and cats?
Just dogs and cats.
Okay.
Yep. I wouldn't say that we absolutely wouldn't see another, small animal species, but that's not our primary pursuit. The other specialty services that we do offer there is laparoscopic spay procedures, as well as gastropexy procedures, and that's a procedure where we actually tack the stomach to the inside of the abdominal wall to help prevent torsion and bloat. It's a condition seen most commonly in large and giant breed dogs.
Oh, interesting.
Yep. We also have a veterinarian on staff who is passionate about acupuncture and rehabilitation therapy. So those aren't necessarily specialties, but they are certifications that a veterinarian will pursue. So those are some of the specialty things we offer.
Do you guys do major surgeries there?
Yeah. So, for example, just a couple weeks ago, we had we had an English pointer that came in, was vomiting, and turned out had a foreign body in the stomach that we had to go into and remove surgically. And so that's a major surgery. You know, anytime you go inside of an internal organ like a stomach or the intestines, that's major surgery. We also take abdominal masses out. Sometimes we'll have spleens that we have to take out, those sort of things. So we'll do surgeries of that magnitude. Typically, our orthopedic surgeries, we're going to refer to a specialist.
Okay.
Yep.
And how often are you removing, or how often is there things going in dogs' stomachs?
Right. Yeah.
I know you talked about this
Yeah.
before.
It seems like it kind of goes in streaks.
Yep.
And I think that's kind of the common thought in whether you're veterinary medicine or human medicine, things come in threes. So, that was the first of three, and we haven't seen the next two yet in the short period of time. But, let's see, last week we did have a case where we had a dog that had a bladder full of bladder stones.
Okay.
And so those were removed surgically, which is absolutely the appropriate thing to do in this case because bladder stones can cause obstruction of the urethra and inability to urinate. So big deal.
Do you have any tips for dog owners to keep their dogs out of things or prevent any good preventative maintenance?
Wow. And that's a good question because every dog is different, right? But I think, I particularly think of people that are, say, moving into the area or maybe have a cabin that's remote. You know, oftentimes cabins, people keep some rat bait out, or somebody moves into somebody else's home. Or maybe they had a shed or a barn, they left some rat poison out, stuff like that. So that's tough because rat bait is attractive to animals. And so I guess the main thing is be vigilant. Go around, look in those spaces, look in the crawl space, look behind the door in the shed or wherever, and just make sure nothing was left behind. Some of the other common things we see in veterinary medicine that animals got into, say, ate chocolate, ate raisins, ate grapes. Dogs like to eat things. Yeah. Foreign bodies. You see your dog chewing on something they shouldn't, take it away, replace it with something else, and that'll save a lot of trouble.
As far as the amount of, you said grapes or chocolate, how much is a dangerous amount?
Yeah, and that's a great question too. The grape and raisin side of things is, I don't know that anybody has actually quantified how many grapes or raisins a dog can eat and not have problems. And we don't see that every dog has problems, but we always want to pursue those dogs as if they could have problems because we want to prevent the issues. And same with chocolate toxicity. Not all dogs are as sensitive to chocolate as other dogs.
Yeah.
But if somebody calls us and says, hey, my dog got into chocolate, we are going to advise a couple things. One, feel like it's always appropriate anytime a dog eats a toxin for the client or the pet owner to reach out to the pet poison hotline or helpline and share with them, because they're going to get to talk directly to a toxicologist there and share with them what their dog ate and how long ago it ate it. And they may even say, no big deal, right? But they may also say, here's our treatment plan. You need to go to the vet. Whereas if a person comes straight to us with a toxicity concern, we are not always in a position to be able to calculate definitively if it's going to be a big deal or not, right? Yeah. And so I think sometimes people can save money by calling the pet poison helpline first. And then if it turns out they need our intervention, we have a definitive treatment plan from a toxicologist. So it works really well.
Yeah, that makes sense.
Yep.
So as far as the practice, is there anything else folks should think of you guys for specifically? Or
yeah, so one of the interesting things about our practice is I continually hear people say how much they appreciate the quality of medicine that's practiced at Gallatin Veterinary Hospital, and just they feel like there's high quality there, and that's a huge compliment. Not necessarily a compliment to me because I haven't been there that long, but I appreciate knowing that, and I appreciate being on a team where we receive those compliments all the time. Anything else we should know? Yeah, I think that I think that, people can rest assured that when they come to Gallatin Veterinary Hospital, they are going to get high-end care, high-end options. I feel like we're also a team that works with people, and we know that how should I say this? We know that we all have to make different decisions through the pathway or the journey of treatment and diagnosis. And I feel like we're a team of veterinarians and support staff, technicians, and so forth that work together with our pet owners.
Yeah, I'm sure the quality is something people look for because a lot of pets are like their family.
Absolutely.
To everyone.
Yep.
Yeah. Where's the clinic located?
So, yeah, it's really a great location. It's off of Frontage Road.
Okay.
Address is Reeves Road. And so it's between the 7th and 19th Street exits on the Bridger side of the highway.
Okay.
So really easy access. It's not downtown. I don't have to deal with downtown traffic.
Yep.
Easy if you're coming from Belgrade. Easy if you're coming from, down toward Big Sky, wherever.
Yeah. So it's is that by the Les Schwab?
It is. Yep.
Okay.
It's actually on the other side of the interchange from Les Schwab.
Okay.
Yep.
Yeah,
But it's that same neighborhood. Yeah.
Cool.
We're actually located right next to a newer veterinary practice, which is Bridger Veterinary Specialists.
Okay.
And so we're the general practice right next to them.
Okay. Do you guys complement each other?
We do. Yep. We will send, sometimes we'll have a dog come in with a fractured leg, and we want to present the option of a board certified surgeon to provide care for that leg. And so we'll send that patient to them. They have a number of specialists, oncologists, ophthalmologists, those sorts of specialties. And so it's nice to have that specialty practice nearby that we can, continue to pursue diagnosis and treatment at another level.
Yeah, that makes sense.
Yeah.
And where's the best place to find you guys?
Best way to find us,
as far as not driving there.
Yeah. So we have a web presence. We have a Facebook presence, and GallatinVet.com, I believe, is our web address.
We'll make sure.
Okay.
I'll put it in the show notes. Anyway.
Yep. Yep. So great ways to find us: social media as well as our website.
Cool. Yeah, I'll link all that.
Okay. Yeah.
Anything else? I mean, how'd you become a veterinarian? And
So I always wanted to be a vet when I was a kid.
Yep.
Not uncommon for kids to want to be vets. We love, kids love pets, love animals, want animals to be well, all those things. We respect veterinarians. And so I wanted to be a vet. My dad was actually a dairy farmer back in Michigan. And I'm pretty sure this experience of going to the dairy farm and watching a veterinarian do a C-section on a cow was a pivotal moment for me. I think that's really where I said, I want to be a vet, right?
Yeah.
And which is interesting because those cows weren't pets, right? But it was just so amazing to me to watch that procedure happen and then see a live calf and see mom recover well and all that. So I got good grades in high school. They weren't straight A's, but they were good. And then I went to college and struggled with chemistry, honestly, and got diverted onto another pathway. And I actually got my undergraduate degree in elementary education. Okay. And then from there, moved back toward pursuing veterinary medicine.
Very cool.
With renewed resolve.
Yeah.
Yep. Yeah.
Well, cool. Yeah, I'll get this all linked, and hopefully anyone locally that's looking for a vet will find you. And hopefully anyone that's passing through town doesn't need to find you guys, but if they do, you're there.
Right. Yep. Yeah. Always appreciate people calling.
Perfect. Thanks, Jereld.
Yeah.